I'm Christopher Lance Booker, and my group is comprised of James, Brian, Luciano, Ivan, Thao, and Nataly. Okay, so our group decided to do engineering better medicines, and with a specific thing that we wanted to focus on was addiction and overdose rates in the state of Texas. Because most of us have lost a loved one or someone we knew to an overdose, or we know somebody who has an addiction to a drug. The problem in our society is that more people are addicted to opioids than any other prescription drugs. So we thought that it would be very good for us to focus on those, and so that we could limit the amount of those drugs that are taken by the individuals taking those drugs.
The code itself requires several user inputs. Among these include the user's age, weight, and height of the person. In addition to this, the user must select one of the pre-selected drugs based on overdoses and the number of days for a prescribed medicine. In the command window, the following outputs would appear: the patient's ideal body weight, the safety ranges for the chosen medicine, and the recommended dosage per day. Lastly, a recommended refill count for the patient will be outputted based on the dosage per day.
Okay, so James pretty much covered the user inputs before, but I'll just kind of go over it again on the algorithm sheet. So to kind of start things off, the user will input a couple of things like their gender, if they're male or female, their height. They could input their height in inches or centimeters. They could also input their weight in kilograms or pounds, and they could also choose the type of medicine they would like to be prescribed. Alright, for the algorithm or method that we approach to this problem is that in our code, we wanted the user to input their gender, their height either in between inches or centimeters, their weight in pounds or kilograms, and the medicine choice. With the equations that we use to get their ideal body weights for the male and female, we use the following conversions and equations that's written in the algorithm sheet. And so whenever they input their height or weight, we adjust it so that it follows to the equation shown in the algorithm sheet. And from those calculations, it will give us the ideal body weight for both genders. Okay, once all the calculations has been made, the user will choose the type of medicine they want to be prescribed with. So with all the data that we have, we can determine the minimum and the maximum dosage that will be outputted in our script. And using that range, we can determine the recommendation dosage for the user can take, also depending on the amount of time that the user inputted. Okay, so depending on the gender choice, the algorithm will go either to the male flow side of it or the female. And what it will do based on the information that the user gave us by their height and their weight, the equation works mainly just with kilograms. So our weight, if the user chooses in pounds, the weight has been converted into kilograms in the function that we have in the script. And so for the males, it goes by 50 kilograms plus in parentheses 2.3 times the height over divided by 60. And as for the females, it's 45.5 kilograms plus times 2.3 times their height divided by 60.
For test case 1, we decided to check on every data validation and see if they're working properly. In the menu that asks the user to select their gender, we prevented them from exiting out the menu. In the next data validation, we asked the user to input how many days is the medicine prescribed. If the user decides to input a negative number, we keep asking them until the 5th try. We just take the absolute value of that input. Afterwards, a menu will appear asking the user to select the measurement their height would be in, inches or centimeters. Then they are asked to input their height. We will use the while loop to stop the user from inputting a negative number. It is the same thing with the weight, as we use the while loop to stop the user from inputting a negative number. In the input for the time, we use the while loop, but at the 5th time, we will take the absolute value of that number. In the dosage, there's a while loop. It will check the user's input and see if the input is in between the safety range. If not, it will keep repeating.
Again, in test case 2, a menu appears asking for the gender of the user. This test case will be based off a female. After, another menu appears asking for the measurement of the user, whether they like to input it in inches or centimeters. After they choose their measurement, it will then be converted to centimeters. Then the user is asked to input their weight. A while loop is used in order to stop the user from entering a negative number. Once their weight is recorded, their IBW and other factors are then calculated. In this test case, since we are considering it's a female, it will be a little bit different than what the formula for the male is. Once that is done, the user is then asked to input the amount of time their medicine has been prescribed. Similar to test case 1, after the 5th time of an incorrect value being inputted, the absolute value of that will be taken. In this test case, we chose morphine as the medicine. It is then calculated that 60 milligrams is the minimum dosage and 120 milligrams is the maximum dosage. After the calculation of the maximum and the minimum, our data is checked for a recommended dose. In this test case, 100 milligrams was not in the recommended range. The user is then asked to input a new dosage. The user inputs 60 milligrams, again not in the recommended range. Then the user inputs 70 milligrams, again not in the recommended range. The final dosage ends up being 40 milligrams. Finally, it is calculated that the required dose of 84 milligrams of morphine per day for 30 days is safe for the patient. Then a refill count is given to the user to allow for pain relief.
In our opinion, this program is very useful for preventing the increasing of overdose death rate. However, there are still some limitations in our program. For example, in our code, it's just including some of the opioid. However, remember, all the opioid that we're actually using in this program is very well used in Texas as well in the United States. Second, we actually have to adjust the amount of dosage each user can take every year, because every year the Department of Health and Human Services will change it. And we also have to input like new data, because the data that we are actually using right now is just from 2018. So if we want to predict how much each patient can take for each opioid, we have to take the data from 2019, 2020, and so on. And also because all the data that we have in this program is just mainly in Texas, so it will be very hard to predict the trend of people using the overdose in the whole United States. So it also requires we have more data in this program. And finally, since the information that we have in here is lacking height, weight, and the medication that is being used with the opioid, which is also really affected the accuracy of this program. So in the future, when we actually have to put this program in use, we have to make sure that we have more data in those kind of aspects.
This project was made in efforts to prevent overdoses on opioids or to avoid intaking an excess amount of prescribed medication. With our research on some of the popular prescription medications, the user will be able to see the probability of becoming dependent on certain medicines. This will help them find ways to prevent overtaking and whether or not their current dose is deemed safe. This can also be a good method for doctors to use when prescribing opioids for their patients.